Imagine this. You're going about your day, feeling fine, maybe a little tired, maybe dealing with a nagging cough, or noticing a small bruise that seems to have appeared overnight. It's probably nothing, right? But what if it's your body trying to warn you? Every year, millions of people are diagnosed with cancer, and unfortunately, many of them never saw it coming. Some of the most dangerous types, like pancreatic, lung or brain cancer, remain silent for years, showing almost no symptoms until they've advanced to a critical stage. The good news, catching cancer early saves lives. The earlier you detect cancer, the better your chances of successful treatment. That's why understanding the subtle warning signs is so important. But I know what you're thinking. Every little symptom seems like cancer when you search online. That's why this guide is different. We're cutting through misinformation and fear to bring you scientifically proven signs that can help you recognize cancer before it's too late. So stay with me until the end. Some of these signs might shock you, but knowing them could save your life. Cancer doesn't appear overnight, it develops slowly over time, often with subtle warning signs. Many people ignore these early symptoms because they seem minor or unrelated. That's why in this guide we're breaking down 15 critical warning signs you should never ignore. These are not meant to scare you, they're here to empower you to listen to your body and take action before cancer spreads. What you'll learn today. The 15 warning signs of cancer and how to recognize them early. How to separate minor health issues from real red flags. When to seek medical attention and what tests to request. Early detection can literally save your life. If you or someone you love experiences multiple symptoms, don't wait, see a doctor. Before we start, subscribe to Healthy Every Day and share this guide with your loved ones. Knowledge is power, and this information could save a life. Now, let's dive in. 15 warning signs of cancer you should never ignore. Sign number 1, persistent fever that won't go away. A fever is usually a sign of infection, but if it lingers for weeks without explanation, it could be a warning sign of leukemia or lymphoma. What makes a fever suspicious? Lasts longer than 2 weeks. Comes and goes in cycles, accompanied by night sweats or unexplained weight loss. Blood cancers weaken the immune system, making you more prone to infections and fevers. If you've had persistent fevers with no clear cause, get a blood test to check for abnormal white blood cell counts. Sign number 2, jaundice, yellowing of skin or eyes. Have you noticed your skin or eyes turning yellow? This is called jaundice, and it happens when bilirubin builds up in the bloodstream, often due to serious liver problems. Possible causes: liver cancer. The liver fails to filter toxins properly. Pancreatic cancer. A tumour blocks the bile duct, preventing bilirubin from draining. Gallbladder cancer causes bile backup, leading to jaundice. Jaundice is one of the few early warning signs of pancreatic cancer. So if you notice yellow skin, dark urine or pale stools, seek medical attention immediately. Sign number 3, unexplained pain that won't go away. Pain is your body's alarm system. If you have persistent, unexplained pain that doesn't improve, it could be a sign of cancer growing in the body. Types of pain that might be cancer include abdominal pain, which could indicate pancreatic, liver or stomach cancer. Pelvic pain may signal ovarian, prostate or uterine cancer. And bone pain could be a sign of bone cancer or metastasis. Pain that is deep, persistent and gets worse at night should not be ignored. If it doesn't respond to normal pain relievers, see a doctor. Sign number 4, dark streaks under your nails. Your nails can reveal hidden health problems, including cancer. Signs to watch for include dark lines under the nails, which could be subungual melanoma, a form of skin cancer. Pale or whitish nails could indicate liver disease or anemia, which is linked to leukemia. Thick, rounded nails are sometimes linked to lung cancer. If your nails suddenly develop black streaks, see a dermatologist immediately. Sign number 5. Bone pain that gets worse at night. Bone pain that doesn't go away, gets worse at night, and isn't linked to injury could be a warning sign of cancer that originates in or spreads to the bones. Possible causes include osteosarcoma, which is bone cancer common in long bones like arms or legs; metastatic cancer, which is cancer spreading from another organ to the bones; and leukemia, which weakens bones, making them painful and fragile. If you experience persistent bone pain along with swelling or tenderness, don't ignore it. Get an X-ray or bone scan. Sign number 6. Vision changes or eye pain. Your eyes can reveal a lot about your health, and certain eye symptoms may indicate serious underlying conditions, including cancer. Warning signs to watch for: blurred vision that doesn't improve with glasses, flashes of light, or unexplained floating spots in your vision, and a growing dark spot on the iris. One of the most concerning types of eye cancer is ocular melanoma, which can develop silently before showing symptoms. If you notice a sudden, unexplained change in your vision, see an eye doctor immediately. Additionally, prolonged sun exposure can increase your risk of eye cancer. If you have light-colored eyes or a family history of ocular melanoma, regular eye exams are essential. Sign number 7. Excessive bruising without injury. Have you noticed bruises appearing out of nowhere? While occasional bruising is normal, frequent or unexplained bruises, especially in unusual places, could be a sign of leukemia or other blood disorders. Why leukemia causes bruising? Leukemia affects blood cell production, reducing healthy platelet levels. Platelets help the blood clot, so low levels make you bruise easily. Unexplained bruising on the arms, legs or hands could be a warning sign. Other related symptoms to watch for include frequent nosebleeds, bleeding gums, and tiny red or purple spots under the skin known as petechiae. If you notice unexplained bruising along with fatigue or frequent infections, see a doctor for a blood test. Sign number 8. A persistent cough or hoarseness. A chronic cough that lasts for weeks, especially if it's dry and persistent, can be one of the first signs of lung cancer. When should you be concerned? A cough that lasts longer than 3 weeks, coughing up blood or bloody mucus, and hoarseness or changes in your voice. Lung cancer symptoms often mimic those of common illnesses like a cold or bronchitis, making it easy to dismiss early warning signs. If you experience persistent coughing or unexplained hoarseness, don't assume it's just allergies. Get checked by a doctor. Another warning sign is chest pain when coughing or taking deep breaths. If you also feel shortness of breath, wheezing or unexplained weight loss, it's time to get a lung scan. Sign number 9. Blood in urine or stool. Seeing blood where it shouldn't be is always a cause for concern. Even if the bleeding is mild or occasional, it could be a sign of serious disease, including cancer. Possible causes: colon or rectal cancer can cause blood in stool, which may be bright red or dark and tar-like. Bladder or kidney cancer can lead to blood in urine, which may appear pink, red or dark brown. If you notice blood in your stool, don't assume it's hemorrhoids, especially if it lasts for more than a few days. Similarly, blood in urine should never be ignored. Even if it only appears once, see a doctor for a colonoscopy, urine test, or imaging scans to rule out cancer. Early detection is key. Colon cancer survival rates are much higher when caught in stage 1 or 2 versus later stages. Sign number 10. Sores that won't heal. A sore that doesn't heal within 2 weeks, whether on the skin, lips, mouth or other areas, can be a warning sign of skin cancer, oral cancer or other malignancies. Common cancerous sores to watch for include a wound that bleeds easily and doesn't heal, which could indicate skin cancer. White or red patches inside the mouth that don't go away may signal oral cancer. A lump or sore on the genitals that persists is another warning sign. If you smoke or drink heavily, your risk of oral cancer increases significantly. Also, excessive sun exposure without protection can lead to skin cancer, especially melanoma. If you have a sore that won't heal, schedule an appointment with a dermatologist or dentist for a professional evaluation. Sign number 11. Persistent bone pain that worsens over time. Bone pain is often dismissed as arthritis, aging or muscle strain, but persistent pain that gets worse over time could indicate bone cancer or metastasis, which is cancer that has spread to the bones. When should you be concerned? Pain that worsens at night or when resting, pain that doesn't improve with over-the-counter pain relievers, and swelling, tenderness or unexplained fractures are all red flags. Bone cancer is rare but highly aggressive, so early detection is critical. If you're experiencing deep aching bone pain that doesn't seem to go away, see a doctor for imaging tests like X-rays or MRIs. Sign number 12. Skin changes or unusual moles. Skin cancer is one of the most common cancers worldwide, yet many people ignore early warning signs. A new or changing mole, persistent skin irritation, or a sore that doesn't heal could indicate melanoma or another type of skin cancer. The ABCDE rule for spotting melanoma A asymmetry. One half of the mole doesn't match the other. B border edges are irregular, blurred or jagged. C color. The mole has multiple shades of brown, black, red or white. D diameter larger than 6 millimeters, about the size of a pencil eraser. E evolving. The mole changes in size, shape or color over time. If you notice any of these signs, especially a mole that bleeds, itches or grows rapidly, see a dermatologist immediately. Skin cancer is highly treatable when caught early, so don't ignore suspicious changes. Sign number 13, sudden unexplained weight loss. Losing weight without trying might sound like a dream for some, but unexplained weight loss can be a serious red flag. Potential causes: pancreatic cancer. Tumours interfere with digestion, causing weight loss. Lung cancer can trigger metabolic changes leading to unexplained weight loss. Stomach or esophageal cancer can cause difficulty eating, leading to weight loss. A sudden drop of 10 pounds or more without changes in diet or exercise is a sign to see a doctor. If weight loss is accompanied by loss of appetite, persistent nausea or fatigue, further tests might be needed to rule out cancer or digestive disorders. Sign number 14, chronic fatigue that won't go away. Feeling tired after a long day is normal. However, persistent fatigue that doesn't improve with rest could be a sign of an underlying health condition, including cancer. What makes cancer-related fatigue different? It's not relieved by sleep or rest. It comes with weakness, dizziness or brain fog. It worsens over time and affects daily activities. Chronic fatigue is one of the most common early symptoms of leukemia, lymphoma and colon cancer. If you feel exhausted all the time for no reason, get a blood test to check for abnormalities. Sign number 15, difficulty swallowing or persistent indigestion. Trouble swallowing, also known as dysphagia or chronic indigestion, might be early warning signs of esophageal, stomach or throat cancer. Signs that shouldn't be ignored: pain or burning when swallowing, feeling like food is getting stuck in your throat, frequent heartburn or acid reflux that won't go away. Many people mistake these symptoms for acid reflux or GERD, but if they persist for more than a few weeks, see a doctor for an endoscopy or imaging tests. Esophageal and stomach cancers are often detected late, so pay attention to changes in digestion. Sign number 16, changes in bowel or urinary habits. Your bathroom habits can reveal a lot about your health. While occasional constipation or diarrhea is normal, persistent changes in bowel or urinary habits could indicate colon, bladder, or prostate cancer. Warning signs to watch for constipation or diarrhea lasting more than 3 weeks. Blood in stool or persistent abdominal discomfort. Frequent urination, weak urine flow, or difficulty emptying bladder. If you notice long-term changes in your digestion or urination, don't ignore them. Get screened for digestive and urinary cancer. Your body doesn't lie. When something is wrong, it gives you signals. Listen to them. If you or a loved one has experienced multiple warning signs, don't panic, but take action. Catching cancer early could mean the difference between life and death. What to do next? If you have persistent symptoms, see a doctor for a checkup. If you notice unusual changes, don't dismiss them. If you have a family history of cancer, schedule regular screenings. Subscribe to Healthy Every Day for more life-saving health insights. Share this guide, it could save a life. Stay informed, proactive and healthy.